So in physical therapy, we have a lot of tools that we can use to help treat our patients. Some of these tools involve the use of electricity, actually, because obviously our nerves are really electrical wires. Now, our nerves, as you probably guessed, we have nerves that control our muscles. We also have nerves that sense touch. We have nerves that sense sharp pain. So these different nerves allow the signal to travel at different speeds. Now, what this allows us to do is really use electricity, knowing which frequency these nerves operate at, and setting our electrical unit for those specific frequencies. So I can use electricity to help block pain. I can also use electricity to help contract a muscle. Now, a muscle contraction is a large process that has to occur for a muscle to contract, which you can get in biology, a little better understanding. However, what we're really doing is changing the electrical pole or the charge above a motor unit. So motor unit is where a lot of nerve endings come and where there's a higher density of nerve endings in a specific muscle. And so using electricity, I can make an individual's muscles turn on and off following the parameters that I have set. So what we've set here is an individual to create some wrist flexion as well as rotation of the forearm. This motion is called pronation. And so my example here is not using any of his own muscles. It's this little unit that we've set to cycle on and off. We currently have it contracting for 5 seconds. So he has a contraction now. And then the unit will turn itself off, and he will be able to return to his relaxed position. Now, we may use this for an individual who has had a stroke, let's say. So they may have lost some function of their wrist, and we want to kind of regain that signal to the wrist. We can also use this electrical unit on an individual that may have had an ACL or a knee surgery, so very common for football injuries, let's say. So Adrian Peterson had a surgery a couple years ago, and they may have used one of these units to help regain quadricep activation. And so you can use it for lots of different things in the clinic. They also have other units that are similar looking that operate at a different frequency and a slightly different waveform, and that frequency of waveform has been shown to help influence the pain signal. So we have different electrical wires or different nerves that transmit the pain signal, and we can place those pads on so the individual's body senses this electrical signal rather than the pain. And so we do have a lot of tools available to us in the rehab clinic. We don't use them on every patient, but we can use them on several patients, especially depending on our patient population that we're seeing. So as we talked about, we can use electrical signals to help contract a muscle. Now, knowing the anatomy of the forearm, I can use my pad placement to pick certain muscles to create a certain motion that I so desire. So initially, we have him rotating inwards and flexing his wrist a little bit. So we'll get that guy going. So our initial motion here, so I'll stop that. And then we will replace the pads. And create a different motion. And I can get a little more wrist flexion and even some elbow flexion with this positioning. We can also use this on really any muscle. And so we'll use the biceps here to see if we can get his elbow to flex towards his chest. So now we see a mild contraction, and then as I increase the intensity, or I'm increasing the current flowing through the unit here, I can control his arm. And then I can slowly lower him and have this machine cycle on and off. Again, retraining this muscle. And then we can, again, decrease the current and have him relax.